Catholic Health's Cancer Institute at Good Samaritan Hospital has a new tool to help neurosurgeons see and operate on certain types of brain tumors. It's called Gleolan, and our next guest was the first to use it at Good Samaritan. Joining us now via Skype from the hospital is Dr. Boromir Durakchev. Thank you for joining us.
Good morning. Thanks for having me.
This sounds like a pretty exciting new tool. Can you tell us about it?
Yeah, absolutely. This is very exciting and positive development in neurosurgery on malignant brain tumors. This technology was developed initially in Germany, in Europe, and then in the States, and it was just approved a couple of years ago in the United States. Essentially, this is a diagnostic chemical compound used during surgery on malignant brain tumors or brain cancer. It is not a drug, it is not chemotherapy, it is an optical imaging agent, which is taken by the patient prior to the surgery, a couple of hours before the anesthesia. And then it crosses essentially the blood-brain barrier and accumulates preferentially in the tumor cells. And one of its byproducts, called protoporphyrin 9, has a very unique features to fluorescence pink/violet light. What is the implication of this? It makes the tumor very easily identifiable and visible by the surgeon, and which makes the complete resection possible, feasible, and it eventually translates in significantly decreased chance of tumor recurrence, residual tumors, and eventually it extends patient's life, and it leads to improved survival.
So, Doctor, we're looking at some video right now, and we see that most of it was purple, but then the pink color. Is that how this is illuminating the cancer? This is what you see in the operating room?
Yeah, exactly. So some technical details. Once the compound accumulates in the cancer cells, like I said, one of the byproducts has unique features to release pink light, which is visible only if you subject the brain and the tumor with a blue light released from the operating microscope. Like you can see on this intraoperative picture, we have an operating microscope supplied with a special blue light filter. So under this blue light, everything all of a sudden changes. It's a very magical, amazing view where the surrounding brain and the whole environment is blue, and the tumor cells are glowing pink light.
You're the first to use this, and tell me about the difference it's making compared to doing the same surgery without it.
It makes a big difference. Yes, I had the immense support of the administration, the leadership of Catholic Health and Good Samaritan, and they helped us have all the technology, the drug, the intraoperative equipment available at Good Sam. And just a couple of weeks ago, I performed the first such Gleolan assisted surgery. It really made a big difference. It helped me and my team really see the tumor much better, and it was really a very complex, deep, large mass infiltrating the normal brain, and the post-operative MRI demonstrated essentially gross total resection of the tumor, which otherwise would have been very challenging to accomplish because of the unique features of these tumors to grow like tentacles within the brain. And under white light, sometimes, and actually most of the times, you lose exactly the interface between the normal brain and the tumor. And this way, it is essentially, you see everything in pink is abnormal. It needs to come out.
Obviously, this is such delicate surgery, and your goal is to remove as much as the tumor as possible without affecting any other part of the brain. And I heard a good analogy once or description that, taking brain surgery is like a thimbleful of sand is the tumor, and removing one little piece of sand at a time. It's just that delicate. And I can see that having those colors there, helps you with this surgery.
Yes, absolutely. I mean, some people make the analogy of a drop of blood in a glass of milk. So you have the white, the milk, which is the normal brain, then the bright red blood, the analogy of the tumor, but then in between you have a significant area of pink. This is just analogy. This pink has nothing to do with the Gleolan, but exactly the Gleolan, this optical imaging agent helps you see not only what is absolutely obvious, the normal mass in the middle, but all this borderline brain tissue infiltrated with cancer cells.
Now, is this something you give your patients the option of you doing? Will you recommend it now to your other patients? Is it their choice?
Yes, I will recommend it to any future patient with such lethal, dismal disease. The protocol, it is very safe. It has very few side effects. Essentially, you give the patient the liquid form of the Gleolan, the drug. They drink it approximately 2 to 3 hours before anesthesia. And then we go ahead with our routine craniotomy, expose the skull, the brain, the tumor using image guidance, which is another component of brain tumor surgery these days. And once you are pretty sure that you're exactly where the tumor is, you bring in the operating microscope and alternate between white light and the blue light and kind of have the immediate feedback about how does the tumor section progresses. And you have a very, very reliable feedback and feel about how much you have resected and where the boundaries of the cancer are.
Well, this is extremely exciting because it is new. It was just approved by the FDA only just a few years ago. Do you see any downside?
I'm sorry, your audio signal dropped, and could you please repeat?
I was wondering if you see any downside to this.
Absolutely not. This tool is the future, and it is becoming the standard of care in the treatment of brain cancer. Side effects are almost none. The only one which is well known, and it is very mild, is photosensitivity, meaning that within 48 hours after the surgery, the patient is at risk of developing essentially skin rash, like a sunburn if exposed to a normal white light. Therefore, the recommendation is to keep them in a dark environment.
Wow. Well, I'm so glad to hear about this because this is pretty exciting. What an advancement, and anything that can help you with that surgery is pretty wonderful.
Absolutely. I lost your signal for a second, the audio again.
Okay. Well, thank you, doctor, for all the information. It's just fascinating and exciting, and thank you so much for your time.